Alzheimer's Accountability Act, which called for NIH to develop a budget to estimate the cost of meeting the goal of a prevention of a cure for Alzheimer's by 2025, was passed in 2015, fiscal year 2015. And it called for us to make those projections on an annual basis, taking into consideration scientific opportunities and no other barriers. So up until that point, there had been some increases in the base amount of monies focused on Alzheimer's disease research at NIH. But since that law has been passed and we've been able to send those estimates to Congress, there have been really exponential increases, $350 million, then $400 million, then $400 plus million, $425 million just this fiscal year. So the total amount of spending on Alzheimer's and related dementias at NIH this fiscal year is going to be about $2.3 billion, as opposed to in 2013, I believe, was something like $615 million. So it's been tremendous growth. So I can say that dementia is very costly for us. We have some really nice estimates that have been done by our scientists that in 2010, the cost of dementia care, the direct costs, hospitalizations, nursing home care, medications, was about $110 billion. And it's anticipated that by 2040, without even taking into consideration inflation, just the growth of the number of baby boomers who are older, that cost is going to approach $510 billion in total. So it's very costly. When compared to the cost of heart disease care, of cancer care, it's greater than those. It's taking a toll. I think the thing that's very promising is that there's such a wide variety of approaches that are being looked at. Yes, things are targeting tau, they're targeting amyloid, they're targeting neuroinflammation, they're targeting changes in synapses. Just a whole array of possible things to make a difference in this illness, which appears to be very complex. There is probably not going to be a single answer for making a difference, so it's appropriate to target all of these things. I'm hopeful that some of the studies that are looking at exercise and cognitive training and nutrition may lead to some significant results. We don't know yet, but lots of promising opportunities. One big misperception about dementia is that everyone's going to get it, and that it's just part of getting older. I think that sometimes people ignore changes in cognition in their older relatives because they think that's part of the aging process, and it's not. It's something that should be looked at and evaluated. So what we're seeing is that the prevalence of dementia is higher in African Americans and Latinos. We're finding that some of the risk factors associated with dementia are higher in those populations, high blood pressure, diabetes, those sorts of things. And that suggests that there are some opportunities to try to make a difference. We don't yet know definitively that changing those risk factors is going to make a difference in the outcomes, but certainly things like the SPRINT trial that came out in January that showed that intensive blood pressure control may help with mild cognitive impairment, which is a precursor to dementia, says that we ought to be trying to do more about that for those populations.